My name is Kelly Faber. I am a pediatric hospitalist. I was called to missions not as a young age, although I always wanted to be a physician from as early as I can remember. I didn't necessarily think that that was going to be in a missions capacity. In medical school, though, I had a mentor, Dr. Tina Slusher, and she did missions, but also worked in academic medicine and spent about 3 to 4 months of her year serving overseas, mostly in Nigeria and Kenya. So I got to see her life and how she married the two of academics and missions, and thought that that would probably be my future. But the hope was really to be a pediatric oncologist. So those are the steps I took to do a pediatric residency. But as I was applying to that fellowship program, I was going to have a gap year, a year where my fellowship was not going to begin, and I had something to do for a year. And it was actually at the Global Missions Health Conference that I went there searching for a program, something to do for a year. And I ended up finding the post-residency program through World Medical Mission. And that was a 2-year program. So I applied to that program, was accepted, pulled my fellowship application from oncology. And for me, it came down to a very practical choice of thinking if the Lord would return in 2 years, and I was in the middle of a fellowship, for a split second before worshiping the Lord, I would think I should have gone. I was not supposed to be here. I was supposed to be overseas. But that if he returned on that day and I was serving overseas, I wouldn't regret not doing a fellowship. So for me, it was very practical, and that decision was made to follow the steps to missions. So I went to Togo temporarily, thinking it was 2 years, and a year in, they were constructing another hospital 8 hours north in a new community, and said they needed a pediatrician. So it just was a moment with the Lord again to say, I love Togo. I love serving here. I don't miss serving in the United States. They need me, and I have the skill set they need. So I'll go. So I did, and then I've been in the north of Togo ever since. Yeah, I had heard of CHSC about 10 years ago, probably, as a few missionaries I knew had joined them, but I didn't know much about them. I knew about them really in word only. And a few years later, I ended up reading the book When Healthcare Hurts. And so I knew of Greg and CHSC. But it wasn't really until probably 6 months ago, a coworker and I were thinking about starting our own 501c3 organization about quality and safety, bringing people dignity through high quality care. And I emailed Greg to maybe see if he could offer some advice to us, because I knew that their mission really was in line with our thinking. And yeah, and there was an invitation for us to join CHSC, because we just really felt like our view of missions, of people, of vulnerable people, and how to give them the best possible care were in line. So we just really felt like that was the right step to take, to not reinvent the wheel, but to come under CHSC and see what we could do to proclaim Jesus while bringing quality care to vulnerable people. I've said in other places too that the mission field is often like a rocky beach, where the sand is the good moments, the positive moments, the moments you know you're supposed to be there, and the difficulties are the rocks. And even though there's so much more sand, when sifting through all of it, you're kind of left carrying the rocks. And that's kind of what stays with you. So it's easy to hold on to the difficulties and remember the good. But for me, the mission field was always something I was prepared to be hard. And maybe hard in a certain way. I always say you think you're ready and you think you're prepared for the worst, And to me, the worst was losing your life, right? Just laying down your life in whatever way. And I went to the field ready for that, actually, of just expecting it. Like, I'm probably just at some point not going to make it home. And it was okay to me. I really feel like to live is Christ and to die is gain. And that was always very real to me. But a year in, instead, one of my best friends' life was taken on the field. And that I wasn't ready for. Almost like you make a bargain with the Lord of how you're willing to sacrifice for Him and how you're not. So it's really interesting that even the Lord kind of knows you enough to say, hey, I'm going to make it hard, and not out of being unkind. The Lord is good to us all the time, but I learned more about the Lord during that time, very, very dark days. But I learned more about the Lord and His closeness and His sufficiency in us and through us during that time that I could have ever learned laying my life down for something and coming to terms. Why are you here? Are you here to serve these people, to serve me, or are you here to serve because other people are here? And a real crisis of belief, but one that was necessary for me. And I wish Todd was here, but at the same time, the Lord used the taking of his life to change my own in ways that I know will be redeemed one day.